Let me take you to the heart of the Roman Empire, where the foundations of modern healthcare were laid. Ancient Rome was more than just a land of military conquests and grand architecture. It was a civilization that prioritized public health and medical advancements in ways that would shape the future. From the development of public hospitals to surgical techniques that are still in use today, the Romans pioneered groundbreaking innovations in healthcare. But how did they achieve all of this? Let's uncover the medical marvels of ancient Rome and their lasting legacy. One of the most remarkable contributions of ancient Rome to healthcare was the establishment of the first public hospitals, known as valetudinaria. Initially created to serve injured soldiers, these hospitals later expanded to care for the poor and enslaved individuals. Unlike earlier civilizations, which relied on home-based healing or temple-based care, Rome introduced a structured, organized healthcare system. These hospitals were strategically located near military forts and cities, ensuring that medical aid was accessible. Each valetudinarium featured specialized rooms for surgery, recovery, and long-term care, with a focus on hygiene and efficient patient management. Some records suggest that medical staff included not only trained doctors, but also assistants and orderlies who ensured that treatments were carried out effectively. This marked the beginning of institutionalized healthcare, a model that modern hospitals continue to follow. Rome's emphasis on sanitation and public health set it apart from other ancient civilizations. The construction of aqueducts provided clean drinking water to millions, reducing the spread of waterborne diseases. Advanced sewage systems, including the famous Cloaca Maxima, efficiently removed waste from urban areas, preventing contamination and keeping streets clean. Public baths, though primarily used for social purposes, also promoted hygiene by allowing citizens to wash regularly and reduce the spread of infections. Beyond infrastructure, Roman officials implemented strict public health policies. Markets were regularly inspected to ensure food safety, and laws were enforced to prevent the dumping of waste into public spaces. The Romans also established a rudimentary form of quarantine, isolating individuals with contagious diseases to prevent outbreaks. Their widespread focus on sanitation laid the groundwork for modern public health initiatives, demonstrating that a clean environment is essential for disease prevention. Roman physicians, heavily influenced by Greek medical knowledge, developed advanced surgical techniques and instruments that greatly improved the practice of medicine. They performed amputations, cataract removals, and even early forms of cosmetic surgery. Roman surgeons used scalpels, forceps, bone saws, and specialized tools such as the speculum for gynecological exams. Unlike earlier cultures that relied on rudimentary methods, Roman doctors employed pain management techniques using opium and wine, making surgeries more bearable. One of the most significant advancements in Roman surgery was the use of hemostatic techniques to control bleeding. Surgeons developed methods to tie off blood vessels, a practice that was revolutionary for its time and helped prevent excessive blood loss during operations. Roman military surgeons, in particular, excelled in treating wounds and fractures, often using splints, bandages soaked in vinegar as antiseptics, and early forms of sutures made from plant fibers or animal intestines. Their contributions laid the foundation for modern surgical procedures, some of which are still practiced today. The Romans understood that medical knowledge had to be systematically taught and passed down. The first medical schools in Rome trained future physicians in anatomy, pharmacology, and surgical techniques. The most famous medical practitioner of the Roman era, Galen, contributed significantly to medical education by writing extensively on human physiology. His teachings, based on the dissection of animals and observations of human anatomy, influenced European and Islamic medicine for over a millennium. Medical students in Rome learned through a combination of theoretical instruction and hands-on practice. They studied the works of Hippocrates and Galen, practiced surgeries on animals, and assisted experienced physicians in treating patients. Rome's medical institutions also emphasized practical experience, often requiring students to train in valetudinaria before practicing independently. By formalizing medical training, Rome ensured that healthcare continued to evolve, a practice that remains central to medical institutions today. Roman physicians were among the first to establish ethical guidelines for medical practice. They followed principles similar to the Hippocratic Oath, emphasizing the importance of patient confidentiality and proper conduct. Some Roman doctors believed in the idea of treating all patients, regardless of social class, a principle that would later become a cornerstone of modern medical ethics. Additionally, Roman medical texts often discuss the responsibilities of physicians, stressing the need for honesty in diagnosis, precision in treatment, and continuous learning. Some physicians, like Galen, argued that doctors should act with humility and always seek to expand their knowledge. These early ethical frameworks helped shape contemporary standards in medical practice, reinforcing the doctor's duty to prioritize patient welfare above all else. The Roman army was a powerful force not just in warfare, but also in the advancement of medical knowledge. Battlefield injuries provided invaluable experience for surgeons, leading to the development of innovative treatments for wounds, fractures, and infections. Military physicians pioneered the use of tourniquets to control bleeding, antiseptics, such as honey and vinegar to prevent infections, and field hospitals to provide immediate care to injured soldiers. The organization and efficiency of Roman military medicine became a model for modern emergency and battlefield medicine. The Medici, army doctors, were well-trained and worked in mobile hospitals that could be set up quickly during campaigns. Their knowledge of trauma care was later incorporated into civilian medicine, proving that necessity truly is the mother of invention. Rome's vast empire allowed it to absorb medical knowledge from conquered territories. From the Greeks, they adopted anatomical studies. From the Egyptians, herbal remedies. And from the Persians, advanced surgical techniques. The Romans also integrated methods from the Celts, who used medicinal plants unknown to Roman physicians. This cross-cultural exchange enriched Roman medicine, leading to a more diverse and effective healthcare system. Roman physicians experimented with new treatments, expanding their pharmacological knowledge and refining medical procedures. This blend of knowledge set the precedent for cross-cultural medical advancements, which continue to define global healthcare systems today. The legacy of Roman healthcare innovations is undeniable. From the establishment of public hospitals to advanced surgical techniques, sanitation systems, and ethical medical practices, Rome's contributions have had a lasting impact on modern medicine. Their emphasis on public health, medical training, and battlefield medicine set the stage for centuries of progress in healthcare. The Roman approach to medicine was not just about treating illness, it was about creating a healthier society. So, the next time you visit a hospital, use clean water, or receive advanced medical treatment. Remember that ancient Rome played a crucial role in shaping the healthcare we rely on today.